Histamine is a biogenic amine found in high concentration in the lungs, skin, and gastrointestinal tract. It is also found all around the body. Histamine is localized in the mast cells, basophils, enterochromaffin cells, and histamigenic neurons. Histamine acts mainly on one of two G protein coupled receptors, H1 or H2. There's also H3 or H4, but not much is known about them. H1 receptors are located on the postcapillary venules, vascular beds, in the central nervous system, the peripheral nerve endings, the respiratory and gastrointestinal tract smooth muscle, and the heart. Histamine 2 receptors have fewer sites located in the heart, stomach, and uterus. Histamine is released in response to complement proteins, antigens, drugs, and foods, and histamine causes the release of gastric acid from parietal cells, as well as numerous allergic reactions. Histamine 1 receptors, when blocked by antihistamine, prevents histamine binding, which therefore prevents the release of histamine triggered calcium release, which then causes a decreased capillary permeability, smooth muscle relaxation, vasoconstriction, reduced sensory nerve ending pain, and reduced itching. When antihistamine binds to H2 receptors, it causes a decreased cyclic AMP release, which prevents gastric acid secretion from parietal cells in the periphery. It also causes vasoconstriction and decreased permeability on the blood vessels. H1 antihistamines come in two generations. There's first and second. First generations provide relief of allergic symptoms but will antagonize muscarinic receptors, causing many unwanted side effects such as dizziness, blurred vision, nausea, and dry mouth. And second generation antihistamines are much more selective for H1 receptors and therefore do not cross the blood brain barrier, reducing adverse effects related to unwanted CNS antagonism. On the other hand, H2 antagonists act at the parietal cell to suppress secretion of gastric acid, both at rest and post meal. The enterochromaffin like cells are blocked from binding the parietal cell H2 receptor. Major H2 antihistamine in production at the moment is cimetidine.
Figure 1 depicts the release of histamine from mast cells in a type 1 hypersensitivity reaction. As we can see, an antihistamine blocks the histamine receptors at the nerves and other tissues and prevent histamine from binding to its receptor. As with any drug, there are side effects associated with the use. Some of the major side effects include drowsiness, fatigue, dizziness, dryness, and blurred vision. First generation antihistamines are lipophilic, meaning that they can cross the blood-brain barrier, meaning they have central nervous system side effects, which can include decreased cognitive processing and also drowsiness. They also have some anticholinergic effects, including blurred vision. Second generation antihistamines are more specific for the H1 receptor, and they have a low affinity for non-histamine receptors, such as cholinergic receptors, and they're lipophobic, so they can't cross the blood-brain barrier. Unfortunately, some of them are known to be cardiotoxic, as they may have potassium-blocking properties in cardiac tissues. While third-generation antihistamines are cardiosafe, and they are built upon metabolites of first-generation antihistamines. They have minimized side effects associated with both first and second generation antihistamines. Side effects of antihistamines also depend on the type of receptor which they act on. H1 antihistamines, such as pyramine, can be antiemetic, cause drowsiness and decrease pain, while H2 antihistamines, such as cimetidine, can cause constipation or irregular heartbeat and H3 antihistamines such as thioperamide can cause drowsiness, hunger, and decrease pain. Antihistamines can interact negatively with some other drugs, such as blood pressure medications. This includes beta blockers such as propranolol and calcium channel blockers such as nifedipine, both of which should be avoided. While antidepressants, sympathomimetics, and MAO inhibitors should also be avoided, as the body will not process MAO inhibitors properly, and this could lead to increased blood pressure, tachycardia, and also seizures. While alcohol should also be avoided at all costs when taking antihistamine, as this can add to antihistamine's drowsiness effect.